Cardiac rhabdomyoma is a rare type of benign cardiac tumor that primarily affects children and young adults. This comprehensive script aims to provide medical students with a detailed understanding of the epidemiology, pathophysiology, genetic abnormalities, and various aspects related to the diagnosis, management, and ethical considerations of cardiac rhabdomyoma. Cardiac rhabdomyoma exhibits variations in its incidence, prevalence, and demographic distribution worldwide. While it is considered a rare entity, it is the most common primary cardiac tumor in infants and children. Geographical variations suggest a higher prevalence in certain geographic regions, but the exact etiological factors leading to this distribution remain unclear. Furthermore, potential risk factors associated with the development of cardiac rhabdomyoma will be explored in detail. The underlying pathophysiology of cardiac rhabdomyoma involves abnormal cellular proliferation, disrupted differentiation, and dysregulated angiogenesis. The dysregulation of the mammalian target of rapamycin, mTOR, signaling pathway plays a crucial role in tumorigenesis. Detailed mechanisms of cellular growth, differentiation, and angiogenesis will be discussed, along with the involvement of mTOR pathway dysregulation in the development and progression of cardiac rhabdomyomas. Cardiac rhabdomyoma is often associated with various genetic abnormalities, including mutations in the TSC1 and TSC2 genes. These mutations are responsible for the development of tuberous sclerosis complex, TSC, a multisystem disorder frequently associated with cardiac rhabdomyoma. The impact of these genetic abnormalities on tumor development, as well as their clinical implications, will be thoroughly examined. The diagnosis and management of cardiac rhabdomyoma in the neonatal period present unique challenges. This topic will explore potential prenatal diagnosis techniques, including fetal echocardiography, and discuss available treatment options for neonates with cardiac rhabdomyoma. Furthermore, the long-term outcomes and potential implications for neurodevelopment will be addressed. Cardiac rhabdomyoma is often associated with extracardiac manifestations of TSC. These include renal angiomyolipomas, central nervous system lesions, and characteristic skin findings. Understanding the relationship between cardiac rhabdomyoma and these extracardiac manifestations is essential for comprehensive patient evaluation and management. Image-guided interventions, such as radiofrequency ablation or embolization, have emerged as potential therapeutic options for select cases of cardiac rhabdomyoma. This topic will delve into the role of these interventions, their benefits, risks, and limitations, as well as their impact on patient outcomes. To better understand cardiac rhabdomyoma, it is crucial to compare and contrast it with other common pediatric cardiac tumors such as fibromas, hamartomas, and teratomas. This topic will explore their distinct clinical and radiological features, aiding in accurate diagnosis and appropriate management strategies. Fetal echocardiography plays a pivotal role in the early detection and monitoring of cardiac rhabdomyoma. This topic will elaborate on the significance of fetal echocardiography, its association with fetal arrhythmias, and potential complications such as fetal hydrops. Additionally, appropriate counseling and management options for affected pregnancies will be discussed. Apart from the physical manifestations, cardiac rhabdomyoma and TSC have significant psychosocial implications on affected individuals and their families. This topic will explore the challenges faced by patients and their families, coping strategies, support networks, and the overall impact on quality of life. In severe cases of unresectable or extensive cardiac rhabdomyoma, cardiac transplantation may become necessary. This topic will evaluate the indications, surgical techniques involved, long-term outcomes, and potential challenges associated with cardiac transplantation in patients with cardiac rhabdomyoma. Cardiac rhabdomyoma shares genetic underpinnings and clinical features with other inherited cardiac syndromes such as tuberous sclerosis complex, neurofibromatosis type 1, and Carney complex. This topic will delve into the overlapping characteristics and genetic associations, aiding in accurate diagnosis and appropriate management strategies. The management of cardiac rhabdomyoma and TSC raises ethical concerns regarding early detection, intervention, and potential long-term risks. Balancing the benefits of early intervention with the uncertainties inherent in the disease requires careful consideration. This topic will explore the ethical considerations involved in managing cardiac rhabdomyoma and underline the importance of patient-centered care. In conclusion, a comprehensive understanding of cardiac rhabdomyoma is essential for medical professionals involved in the diagnosis and management of this rare condition. Through the exploration of its epidemiology, pathophysiology, genetic abnormalities, and various aspects related to its diagnosis, management, and ethical considerations, this script aims to equip medical students with the knowledge required to address the unique challenges presented by cardiac rhabdomyoma.